Well, I think that's a part of the responsibility of the surgeon is to keep abreast of things, and that's part of being a good advocate for the patient, offering them the latest treatments, and in some cases experimental treatments that may provide them and other patients a benefit in the future. So it's really, the key is to stay abreast of the technology through understanding the scientific literature, participating in meetings, and that is really what informs a lot of our decision making related to providing the best result for the patient. So robotic surgery is not one of the key drivers of vascular surgery. There is some innovation in that regard. It's primarily related to the minimally invasive surgeries that we do. So a lot of endovascular and surgeries using wires and catheters and x-rays to see what we're doing. And that sort of thing guides a lot of the innovation in vascular surgery. And it's actually become a very significant portion of the stuff that we do. So we treat aneurysms, particularly of the aorta, which is the most common place to have it. And an aneurysm is an enlargement of the blood vessel. If you can imagine, as a vessel enlarges, a blood vessel enlarges, it becomes weaker. And one of the things we worry about with aneurysms in general is that they can tear and rupture when they become too weakened. Now, the aorta is the biggest blood vessel in the body, and you can imagine that being problematic if that blood vessel tears. So in the past, that's been treated with open surgical repair, meaning replacement of that aneurysm through a big incision in the abdomen. Now, more commonly, arteries and aneurysms, aortas and aneurysms are treated with stents, and stents that basically reline the inside of the aneurysm, preventing that risk of tearing and rupturing. Now, that has its limitations in that you have to preserve blood flow to all of the other organs to the abdomen. So we are using a technique now that involves custom-made stents, essentially customized therapy for patients who have aneurysms that previously would not have been candidates for stents. And those types of therapies are ones that allow us to treat more patients with more complex problems and provide them a therapy that has a good recovery where they previously would have not had that option. The customizations are completely based on the patient's own anatomy. So if you take, for example, a stent like this, so this is an example of one of the stents, it actually has side holes in it that are tailored to the patient's specific anatomy and allows the patient to have this type of custom repair that will preserve blood flow to the intestines and to the kidneys. And this sort of repair is one that 5 or 10 years ago would not have been available in the United States. And so this is actually a significant advance in how we treat patients. Patients that have this kind of therapy have the potential to recover in a very short time and have a very good result. So the prior treatment to this, which is called a custom fenestrated or a custom aortic repair, would have been either to perform open surgery, meaning, like I said, a big incision on the abdomen or the side and repairing the aneurysm directly, or in patients who are felt not to be well enough to undergo such an invasive procedure, they would have not been offered a treatment. And so this actually expands the number of patients that can have treatment, but also provides an opportunity to have a recovery that they previously would not have been able to achieve necessarily.
Are there safety concerns with this, or are there potential risks and issues?
Absolutely. I mean, it is still major surgery, so it's not to diminish the significance of the procedure, and it's still a big deal, so to speak. But with that said, the risks are a little bit different, and often the patients will experience a recovery that is faster, and so they'll get back to their normal life faster, and they may not have the same risk profile or type of risks that are associated with the big open surgery.